when they asked these men about sexual function. Okay, so you had open surgery and robotic surgery.
Mm-hmm.
So what percent of the men were normal after the open surgery? Any ideas?
I'd be totally guessing.
Okay, well, you don't have to guess, so
Okay.
don't. If you had open surgery, how many men reported no problem? They were the same as before. The answer is 2.9% of men
Wow.
reported no problem, meaning 97% of men had a sexual potency problem after open surgery.
It's a lot of
Men,
yeah.
Wow. So we've identified it's a big problem, right?
Yeah.
97% of men are having problems, small or big, small, medium, or large problems. So you can imagine the surgeons clamoring, well, let's get that robot. We're going to get that robot and spend $3 million, and all the men will come here and have their surgery, and they'll be so happy. Right? That's what they probably are saying.
Yeah, that's what they're saying.
Right? Because you have hospitals, most hospitals don't make a lot of money. They have high expenses. You've been in a hospital, you know, they have to pay the nurses and the staff and the doctors, and you got the bills and all that equipment and antibiotics, and half the stuff ends up in the garbage can.
A lot of people to pay.
Right?
Yeah.
And you're open 24/7, and you have to take care of everybody.
It's true.
So you're spending that $3 or $4 million for that robot. And guess what percent of people had no problem with robot surgery concerning their sexual function?
20%.
2.3%.
So that's not much better. That's
What do you
nothing.
mean it's not better? It's worse.
That's worse, huh?
Yeah, 2.9% had no problem with open surgery and sexual function.
That is worse.
2.3% had no problem if they had robotic. So instead of going from 97% to better, you have 97 to 98% of people have a problem with sexual function with the robot.
I told you not to trust the robot.
Well, okay, but how do you make people understand that the robot isn't magic? How do you do that? When you have the robot company spending millions and millions and millions advertising, you've got the patients out there, and most men don't even want to talk about their sexual function. They're not going to go and say, I went to have the robot, and now I've got this big problem. I'm in the 98%. But 98%, you can imagine that almost every man that goes through the robot is having sexual potency problems.
Right.
So how do you do it?
Go on WOR radio. And you
Yeah,
tell.
well, you try to, but this is probably like the only place where people hear the data. And, you know, I mean, John Kerry had radical prostatectomy. Remember a few years ago before he ran for president? He doesn't talk about it.
Right.
And I think Bob Dole talked about it. Bob Dole, I think, had surgery, and then he became the spokesman for Viagra.
Mm-hmm.
But most men don't talk about it, and most surgeons don't tell you there's going to be a 98% chance of having a problem with surgery for prostate cancer.
It's true.
For sexual function. Okay, what's the other quality of life issue for men with prostate cancer?
I mean, all the other symptoms, right? Nausea.
Well, it's
vomiting.
urinary continence.
Yeah.
So can you hold on to your urine?
Right.
You know, so the two quality of life, I mean, there's really four issues I dwell on when I talk to patients. One is sexual function, one is urinary function.
Okay.
The big one is, are you going to be cured or not? Are you going to be alive 5 years later, cancer-free? And are you going to have, you're going to make it through the surgery? Do you want to convalesce from this surgery?
Right.
Okay, so urinary function, 19% of men had no problem with continence if they had surgery,
Mm-hmm.
and 13% had no problem with robotic-assisted procedure.
Mm-hmm.
So
that's
again,
also
with
worse,
continency, robot is worse.
Right.
You know, so you're talking about 80 to 90% of men having continency problems. Now, sometimes it's just laughing and losing control of your urine. Some men have complete loss of their urine. But you can see that this robot is not the big savior that it was advertised to be. And still hospitals are buying it, and still they're promoting it. And you know what the number one treatment in popularity for prostate cancer is in America right now?
A TURP? Transurethral?
No.
What do you...
TURP is just clearing out the passageway.
Okay.
So to cure prostate cancer, there's basically two methods of treatment. Removing the prostate radically.
Mm-hmm.
The TURP is just going through the passageway and roto-rootering. It's just clearing it out.
Okay.
So that doesn't cure prostate cancer. That's like a big biopsy. Or some form of radiation.
Okay.
The number one treatment that men, let's say either they choose it or they get pushed on, is
Surgery.
surgery.
Okay.
And actually, of all those surgeries, it's robotic. It's number one in the
Wow.
choice. So I think that men, I believe, they feel some relationship to the urologist that does the biopsy.
Mm-hmm.
The urologist is a surgeon. The urologist often will recommend surgical treatment. And so men often get pushed into having surgery before they really have a chance to consider all the options and get second opinions.
Mm-hmm.
I mean, this is a serious matter. If you're going to be losing control of your urine for the rest of your life, or you're not going to have normal sexual function for the rest of your life, or if you're not going to be cured, some people die on the table. The death rate's about 1% during radical surgery. So it's a serious operation.
Yeah.
So you can see from this study that quality of life is nothing very great with robotics. It's the hype. We're going to see the nerves. We're going to be able to avoid the nerves. We're going to spare the nerves. It doesn't live up to that at all.
Yeah. What's the success rate like with?
Okay, that's a good question, and I brought that data actually today because I was hoping you'd ask me, even though I didn't tell you to ask me. Okay, so our program is using brachytherapy. We have different programs for different men.
Mm-hmm.
So our premier program for the men with high risk, or they want the highest chance of being cancer-free, is using prostate brachytherapy. Brachy is a Latin word meaning the therapy is next to or close to the cancer.
Okay.
So you poke in the seeds through the skin, you numb up the patient's bottom, it goes through the skin, doesn't go through the bladder, doesn't go through the penis, doesn't go through the scrotum, anus, rectum, which are questions men always ask. You just goes through the skin. The prostate's just under the skin, and it takes about 45 minutes. So we usually, for the premier program for high-risk men, we'll put in the seeds and give them a short course of external radiation, very focused radiation called body radiosurgery.
Mm-hmm.
So if we compare that to, let's say, the chief of urology at one of the biggest hospitals in New York that does this work, and if we base it on, let's say, PSA.
Sure.
So PSA is a prostatic-specific antigen.
Right.
So every man with prostate cancer knows what his PSA is because it's his high PSA that got him the biopsy, and the biopsy got him into the cancer world. So if you have a PSA 4 to 10,
That's high.
okay, so normally over 4 men get a biopsy. If you go to the surgeon 5 years later, 5 years after the surgery, the chance of being cancer-free for PSA 4 to 10 after surgery is 76%.
Okay.
If those same men came to us, our data for the same group of men, PSA 4 to 10, is 90%.
Okay, so it's much higher.
It's much higher. It's 18% higher. And again, there's 200,000 men a year with prostate cancer. So talking about 18%, that's 36,000 lives. 36,000 more men would be cancer-free. And our quality of life is much better. We almost never see urinary incontinency, and the vast majority of our men keep their sexual function.
Yeah.
And there's no death on the table, unlike surgery. So it's really shocking why so many men get surgery, and the surgical results don't live up to the hype.
Yeah.
I have
Sure.
a question for you.
Okay.
Okay, and this is a question I ask every man with prostate cancer. Okay, so you have prostate cancer. Your doctor told you it's localized. He told you he's going to cut out the whole prostate. I told you if you go to the chief of urology at this famous hospital in New York,
Mm-hmm.
the success rate's only 76%. Why does the surgeon, and this is relatively low-risk men, because PSA less than 10, PSA more than 10 is considered a higher risk.
Right.
So it's relatively low-risk men. Why does a surgeon fail to cure the prostate cancer when the PSA is 4 to 10?
Is it because they don't get all of the
Well, obviously they
cancer
don't
cells?
get it all.
Right.
So, but if we are successful 90% of the time, and the surgeon is successful 76% of the time, you can't say the cancer's already traveled into the bloodstream,
Right.
Because if it traveled in the bloodstream, we would fail at the same rate as the surgeon.
Right. Absolutely.
Now, I have to kill every cancer cell. The surgeon just has to remove every cancer cell.
Right.
So it should be easier for the surgeon just to take that walnut-sized mass of prostate, and cut it out. It should be easier for him than for me to kill every cell within that walnut-sized mass.
Yeah, you would think.
You'd think.
Yeah.
So why is it that their success is less than our success?
I'm not sure. Yeah.
Well, I think the answer is they're probably spreading the cancer when they operate.
Okay.
Okay, probably in that bloody. Have you been in surgery yet? Have you done surgery?
I've seen one or two of them. But
Okay,
not,
so you know it's a bloody mess, right?
it is. It's always a
And when
bloody
you start
mess.
handling the prostate, probably you're spreading the cancer cells.
Yeah.
So, and the data for robotic is no different. So it seems like the surgeon, instead of curing the man, is actually probably spreading the cancer.
Hmm.
And if you look at higher risk men, let's just say you go to the PSA 20 to 50. So these are really high risk patients.
Sure.
So the surgeon's success rate for PSA 20 to 50, removing the prostate, famous surgeon, famous hospital, 5 years later, cancer-free, is 44%.
Okay.
And we're at 73%,
Okay,
66% higher.
Still much higher.
Much higher, even more high. Excuse me. So the higher the risk, the more the benefits with our program. But even low-risk men, the 4 to 10 PSA, have benefits. So it's interesting that surgery doesn't live up to its hype for prostate cancer. So that's why I would tell men with prostate cancer, please seek out another opinion. It's better to do it before. Don't be embarrassed. It's your life. It's your cancer. It's how you're going to live for the remainder of your days on Earth. So you should owe it to yourself and your family to get the best possible treatment. We're going to break for our sponsor, and I have to remind you that our sponsor has a great voice. And we'll be back with more information and answering your questions shortly. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York.
News Talk Radio 710
WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Yeah, we're back. Welcome, everybody. Good morning. Hi, Rob. How are you?
Good. Good morning, everyone.
So doctors are continuing to work on making chemotherapy more appealing for patients.
Okay.
And, you know, I spent 6 years at Harvard training and giving chemotherapy to my patients.
That's
Tom
right.
Fry, who recently passed on, was a great chief, spent a long time trying to find methods of avoiding hair loss in patients with chemotherapy treatments, going through treatments. And there's a new FDA